Hello, I'm Stephanie Mehta, editor-in-chief of Fast Company, and I'm joined today by Bill Gates, co-chair of the Bill and Melinda Gates Foundation and chair of Breakthrough Energy Ventures. Thank you so much for being with us today, Bill Gates.
You bet.
Let's start by talking about an overview of where we are today in terms of the pandemic. The U.S. has more than 2.5 million confirmed cases and more than 125,000 confirmed deaths from COVID-19, with cases rising in 24 states. Are these numbers that we're seeing today surprising to you? I mean, back in March, when you were looking at projections for the spread of the virus worldwide, and especially here in the United States, what did you imagine June 30th would look like, both here and abroad?
Well, the uncertainties when you get a new pathogen are pretty big. And I was hopeful a few months ago that the US in particular would be far more on top of the disease. That is, we'd be more like the places in Europe that have seen the massive declines. We opened up a little earlier than they did. Our compliance on distancing, masks, are weaker. Our testing regime still doesn't cover a lot of people. So sadly, both in the US and in the global picture, it's worse than I would have expected. Now South America, the number of cases is gigantic. India, big case rise. And although Africa still modest numbers, the growth there makes it look like most countries are going to have a pretty severe episode. And it's awful, particularly the poorer your country is, the worse you're going to be able to deal with the health system overload.
You mentioned three factors when you were talking about the reopenings, and there's probably more, but you talked about social distancing, you talked about testing, you talked about the wearing of masks. Is there one of those three factors that has contributed more greatly than others when you think about where you had hoped the United States would be in terms of perhaps following a more European-like course toward recovery?
Well, masks, I'm a little puzzled by why that's become political or why there's not higher compliance. It's not expensive, it's not hard, and so that's surprising. The difficulties of access to our testing system, I've been pretty loud about that throughout, and yet, people say, oh no, there's no problem, or very few people, but influential people. And what you're seeing is that there's long lines, it takes too long to get your result, and if you're particularly in low-income communities where the spread has been much higher, and there's a more prevalence of disease in Black Americans, so it's this great injustice coming at the same time that our awareness of a broad set of injustices is more acute. It's really awful, and yet we haven't solved that problem. So the U.S. on a relative basis has done worse than other rich countries, which is ironic because in every other disease, we're advising the world, we're funding the tools, we're going to the various forums, including WHO, and tackling it. This is the first time the U.S. Has not been leading a global response, and even our domestic work has been substandard.
I want to come back to the questions of inequalities that have been brought up by this pandemic, not just in terms of healthcare and testing, but a lot of other social inequities have been exposed. Let's come back to that in a minute and stick with the reopening and the pace of change. You talk to scientists and researchers all the time about what's happening with the research and particularly with vaccines and therapies. Can you summarize where you think we are on that journey? How close are we to coming up with vaccines that can be deployed in a widespread way?
Well, it comes down to a limited number of constructs that are the ones that are at the early stage. Will they work or not? And it's very difficult to get a response in elder people. We don't have the data on that for any of the vaccines yet. Some of these vaccines will be limited by how long it takes to do that safety and efficacy trial. And so, unfortunately, people are kind of have the best case dates in their mind, which is that by the first half of next year, we might have a vaccine. There's no certainty of that. There's really about 3 constructs that, if they worked in their trial very, very well, would start to be available in that time frame. But there's a chance that those 3 won't work, and then you'll have to wait for the ones that are further behind. We've never had as many vaccine projects going after the same disease. It's quite amazing. So one of those is super likely to work sometime next year. Some of them are more manufacturable than others, scaling up because you're going to need billions of doses. And so we're involved in trying to make sure those factories are ready to go for whichever construct gets approved, not just for the rich countries, but for the world at large.
And Dr. Anthony Fauci, whom I know you speak to, addressed the Aspen Ideas Festival yesterday, and he talked a little bit about how, in his mind, a best case scenario would be a 75% effectiveness rate for the vaccine. In other words, with measles, we have a 98% effectiveness rate. But even when it comes to the common flu, a vaccine is not necessarily a guarantee that you won't contract influenza. Can you talk a little bit about, maybe for the people in the audience who don't live in the world of vaccines every day, whether or not a 75% effectiveness rate is hope for optimism?
There's 2 different things you want the vaccine to do. One is to protect the individual, and the other is to stop the individual from transmitting to other people. And those are somewhat different. The amount of virus you have in your upper respiratory is your transmission. The amount you have in your lungs and other internal organs is how much you get sick. And so a vaccine might be particularly good at avoiding sickness but not block transmission. And that's what we're kind of getting data on. If you're 75% effective but only in young people, then for sickness, that doesn't help that much because young people are already pretty protected. It's the 2 big impacts are stopping transmission in everyone, particularly people who move around a lot, and stopping sickness in those at risk of death. And we're just seeing that. Most of the vaccines people know, which took ages to develop, are both transmission blockers and sickness preventers. So they're used to thinking of those as combined. Here, the different vaccines will vary on those capabilities.
You've watched the public sector and the private sector interact in the area of health for many years now. Can you talk a little bit about what's different about the nature of the relationship between the public and private health sector these days? You mentioned that there are 3 different vaccines that are at work here, and that we've never before seen this level of activity around a vaccine. Have we seen this level of cooperation before?
I'm very impressed with how the private sector is showing up here. AstraZeneca jumps in to partner with Oxford. We encourage Oxford to find a partner, and they bring a lot of skills beyond the invention, which Oxford did. We're seeing lots of companies. Usually a vaccine is invented and made by one company. Here we're going to use factories from many companies, and it's not going to be market driven. Most vaccines, other than a group called Gavi that buys vaccines for the poorest, most vaccines are, just whoever can pay gets the vaccines. And here, many of the companies have said, no, they're not trying to make money on this. They're, trying to get it out very broadly. Now, exactly what that means, there's lots of things being negotiated by governments and our foundation with these companies. But I'm impressed how they've stepped forward. This will be a great chapter in terms of the therapeutics and the vaccines that they'll come up with. It's unheard of to want billions of doses and to get it so quickly. And so we have deep expertise in vaccines, and we have the relationships to try and make sure it's optimized without the market being the way that gets done.
You mentioned Oxford having an invention. How would you assess the level of innovation that we're seeing around the race to find a vaccine and therapies for COVID-19? Maybe not just product innovation, but also process innovation. Are there things that you've seen that feel like you've never seen them before in the area of health?
Well, if the warnings, including some I and others made going back to 2015, if we had done a sort of war game simulation, then we would have said, okay, how quickly do you ramp up testing and how do you do that? There are places like Taiwan, Australia, South Korea, who ramped it up so much faster. The US actually had regulatory blocks that weren't cleared until late March for the commercial labs. So we should have practiced to understand these things, and we didn't. And so, now people are scrambling, and, yes, that testing capacity is going up. That's not some brilliance. The U.S. just has more PCR machines per capita than any country by a lot. So, why wasn't that used in the key months? We'll do those postmortems later. But, a study we had pre-funded in the UK found dexamethasone's so far the only thing, along with remdesivir, that helps out. There's still a really good pipeline there. So, when I do phone calls with the pharma CEOs and we talk about, okay, who's doing what, how is this coordinating? There's a lot of very rapid work here, some of which is very novel. And that I am optimistic that we will have these tools, even though we can't give an exact schedule.
You talked about the warnings that you gave 5 years ago. I guess my first question is, if we had to look out 5 years from now, what are the things that we should be planning for today? What are the threats, or what are the processes that we should be putting in place now, knowing that there could be another event down the road?
Well, of my morning TED Talks, the other ones besides an after pandemic are I talk about bioterrorism as a threat, and then I have another talk where I talk about climate change as a threat that you need to invest in advance of it becoming super acute. With natural pandemics this time, although we paid trillions to have the lesson, I do think that the tens of billions that need to be spent to be super ready with diagnostics, therapeutics, and vaccines, that will get spent. The US, China, Europe, all of the things that go back to the New England Journal of Medicine article that I did, that stuff will get funded. It's terrible that it took this to cause it, but yes, we will be ready for the next pandemic.
You believe that we will be ready for the next pandemic?
If it comes, if we get 5 years, say, to really have those things develop, things like the RNA platform, portable PCR, library of antivirals, it takes about 5 years once you get serious to get that really in place. And we'll have to do disease games. We'll have to say, okay, what if a pathogen like this showed up? And okay, what are the steps that you take very quickly? Because with exponential growth, the speed of response has meant some countries are really near zero cases. Australia, China, it's quite amazing. And you have other countries, unfortunately the US very high on that list, where we're nowhere near getting to having this thing under control, which would mean deaths, say, less than 50 a day.
Given all of the time and energy that you've spent on understanding this particular pandemic, COVID-19, what are the mysteries that still remain? What are the things about this particular strain that we still don't know or still don't fully understand?
Well, we were confused about asymptomatic spread, which is, there's both pre-symptomatic and never symptomatic. The experts, we were slow to really talk about how important that was, and that meant pushing masks as an intervention. We were slow to do that. most respiratory diseases make you cough. And so you know that you're coughing, So when you have the flu, you're not that confused about it. If you have TB, you're coughing. Here, just talking, singing, yelling, can make the virus, and particularly some people have very high viral loads who are called super spreaders, can get it way out there. So that's a real surprise to us. Now, finding those super spreaders, who are they? How do you detect them? That's still very unknown. The duration of protection you get if you've been sick, either very sick or mildly sick, you get some protection. We see that, but how long does that last? Which components are key to that? We're still exploring that. And so, blood plasma is partly how we'll get, as a treatment, is how we'll get that understanding. Why it took so long to take off in various countries, including Africa, that's also quite mysterious to us. Sadly, we do know that this is somewhat seasonal, and so the infection rates will go up in the northern hemisphere fall versus what we're seeing today. And that's partly why South America, mostly in the southern hemisphere, why they're seeing such a severe epidemic. Fortunately, Australia and New Zealand got theirs under control, so they have a tiny number of cases. But all of the southern hemisphere has high force of infection, but it'll be our turn in about 3 months.
Do you hear any lawmakers or public health officials sounding the alarm on that fall spike as they talk about reopening? Because it does feel to me like people are talking very linearly about reopening, and that there's a feeling that these phases, phase 1, phase 2, phase 3, will march in chronological order. But it does seem like a fall surge is an X factor that needs to be taken into account.
The trade-offs involved here are very complex. Sadly, the U.S., during its shutdown, we did not get the case numbers way down. And I still put a lot of the blame for that on the idiotic testing regime with no central coordination that we had. But for whatever reason, our patience for lockdown ended while we still had a lot of cases. In China, they don't pay attention to people's impatience. They just lock down. And so they're optimizing for very little disease, but with these really extreme lockdowns in the parts of the country where they see cases. And so, we are, we're not going to get down to very small numbers, and the patience to really go back to severe lockdown, even in the states that are the most fastidious, it's not there. The U.S., wants to come out of lockdown. So now, as opposed to policy, we depend more on individuals. And they, to minimize their mobility, use the mask and things of that nature. And sadly, the last few weeks, we've seen that in many locations, that's not working well.
Earlier, we talked about the fact that the disease and the virus has disproportionately affected Black and Brown communities. Beyond the health issues, we've also seen that this pandemic has exposed a lot of other social inequities. We've seen, the challenges that working parents are facing as they try to deal with children who are now home from school while they're also trying to work. We've seen a real disparity between the conditions for people who can work from home versus those that are essential workers. Do you have a sense, as you talk to business leaders around the country and around the world, that there is a heightened awareness to these sort of social inequities that we're experiencing, and that perhaps there is a role for our economic system and for our business system to try to address them?
Yes, I think it's tragic that almost every dimension of inequity has been heightened. We don't totally understand why Black Americans have been so much more at risk. It's clearly a very multifactorial thing, but it's incredibly tragic that that comes as we're getting this more broad awareness that how much racial issues have not been addressed as much as we need to. Now, you always have to balance, okay, what are the finite resources? Are certain policies, going to limit those resources? This is very complex. We'll end up with more debt and less resources once we get through this. And so how you make the trade-offs, do we trust the leadership to have the right values to appreciate this? It's a intense time politically, and but I'm so glad to see, in terms of some of the inequities, particularly racial, more activation, more discussion, and now what are the solutions that accelerate progress there? That's a tougher thing, but critical.
You are very well known in the Aspen Ideas Festival community for being a voracious reader, for having a great reading list. I've been the recipient of many books from your reading list. I've got to ask, are you finding time during this crisis, when you've been called upon as an expert and that you've been working so hard to try to address, are you finding time to read? And if so, what are you reading these days?
Yeah, actually in March and April, I read less than I had for decades because there was so much disease-related reading that I wasn't doing other things. Now I've found it a more steady state, so I'm fortunately, back to reading, and Melinda and I are watching, various shows, A Million Little Things. I just read this Churchill biography called The Splendid and the Vile, which is, just an incredible story of a leader dealing with a very dire situation, but combining honesty and hope in the right way. So that was pretty inspiring. I'm taking some of these master classes where I just watch Karl Rove and David Axelrod talk about political campaigns, which my son and I watch that together because he loves that stuff. So yeah, the amount of great reading, finally I'm finding some time for it.
If there's anything that our viewers should read to help better understand the pandemic that we're going through right now, or dealing with crisis, anything that you would recommend people pick up?
The Johns Hopkins website, go to that daily. The healthdata.org, which is the International Health Metrics, it's got the forecasts. That gets updated every week, and that's been, although now they're only forecasting out to October 1, and so the fall, the uncertainty range for the fall is dire, and even the modelers won't be able to resolve that. And so a lot of people like Fauci and myself are saying, wow, we don't want to, just be scaremongers or things, but we could go back to a death rate as high as we had at the peak. There's nothing that stands in the way of that. Anyway, the history of like smallpox eradication or the Spanish flu, those are really worth reading, to see how, okay, even though it hasn't happened for a long time, this stuff is pretty extreme. So I've got on my Gates notes a few of these health-related readings that I recommend, but maybe it's just me who finds all that fascinating.
Yeah, well, and I would also recommend that people who are watching this go back and watch the TED Talk from 5 years ago about pandemics. But also, since you've been right, I think people should also go back and watch those talks on climate change and bioterrorism. Bill Gates, thank you so much for your time today. Thank you for being with us, and thanks for the work you're doing.
Great to talk to you.